Check out the full episode of the Bendy Bodies podcast on your favorite podcast app. And speaking of things that are more, widespread, multisystemic, the role of connective tissue in health, getting back to that, what has surprised you the most about the role of connective tissue?
What has surprised me the most is that without our connective tissue, we have no health. So what I learned that I never knew and was surprised to learn was that where our anatomy sits is genetically predetermined. And so if your connective tissue is failing to keep it where it needs to be, then nothing is going to work well. Now, we've always learned from physiology, of course, anatomy and physiology, remember those days? That a lot of our body works through cellular signaling. And so there's an expectation that where the signal is sent out from, that it'll be delivered at a certain place. But when that connective tissue isn't holding that organ and therefore those cells in the place of which, and even if it's off by a millimeter, it's not where it should be. And that signal, while it gets there still, because it's in their vicinity, it's not as loud and it's not as strong. And it doesn't provoke as much of a post-signaling kind of transmission, right? So where the membrane of the receptor on the membrane receives it, and then there's all kinds of membrane transformations, receptor transformations of the membrane, and then it goes into the cytoplasm, and there's a cell, there's different components that take place for the signaling process to get to the nuclei or to one of the extranuclei vesicles in the cell. And so all of that is somewhat suboptimal, because the connective tissue hasn't sort of kept that organ where it needs to be. And so that was a big learning concept for me. And I don't think I explained it even all that well, but that was a big learning concept for me. And so then everything fell from there, where I realized this is why it's such a multi-systemic, complex, phenotypic presentation. And so, and that's where I began. And I started to sort of figure out what do we need to do? And, there isn't a whole lot of options for connective tissue, to be honest with you. And I always, the holy grail question I always say is how do I regenerate how do I fix your connective tissue? Because that's the problem. Mm-hmm. Right? It's not, the meninges are connective tissue. The outer vessel walls are connective tissue. Our fascia that holds our muscles are connective tissue. The neurium that covers the nerves are connective tissue. So it's the fascia that holds our organs in place in our abdomen and our pelvic cavities and even in our chest cavities are connective tissue. So how do I fix this connective tissue so that everything stays put? Mm-hmm. And so, and it's hard. There's no easy answer for it. And so I have dived into a lot of regenerative medicine kind of approaches like peptides and, and I've been working with a company called Hope Biosciences that works under an FDA program called Right to Try to use stem cells, because we know that stem cells can regenerate connective tissue, but unfortunately FDA isn't really clear on how they feel about it. But the FDA has this program Right to Try, of which Hope Biosciences tries to work under with these complex patients. And so I've been working with them, so I'm always trying to think of ways of just sort of regenerating connective tissue, or at least healing it.
Check out the full Bendy Bodies podcast episode on your favorite podcast app.